the help nowadays of Communicare. I was diagnosed with motor neuron disease over 27 years ago. The first 20 of those years, I was able to look after myself. But unfortunately, I did such a bad job that in March of 2008, I had to be hospitalised. I spent 3 days in intensive care. During that time, my social worker introduced me to Communicare. Then in January of 2009, I was finally let go home. And since then, I've been in the care of Communicare. And I haven't had to go back to hospital since.
I met Ted almost 6 years ago. Ted is lovely. Ted is very independent.
I work from home for a company called MJ Flood, helping in their remote management support desk. I just got lucky that I picked a career that has allowed me to continue working, even with motor neuron disease.
On the first call that I receive from a client looking for care, I will call out to the client and I'll sit and I'll chat with the client and I'll talk about their needs, their medical history, but mainly it's to find out who they are.
When I first met them, they just seemed friendly. They were there to ask me what I wanted, not to tell me what they could provide.
Because Ted values his independence, we were able to put short amounts of time in for small breaks where Ted needs a carer for a small amount of time. We were able to provide that.
They were willing to change more to suit me than me changing to suit them.
After care starts, I make personal visits once a month to all our clients. I sit down, I have a chat and a cup of tea, and just checking to see how they've been. I'll go through the care plan to make sure that everybody has filled in the report sheets, and also it'll give me a chance to have a look and see how the client has been over the past month and if there's been any changes.
They come in monthly to see me. We talk about what's going on. They make sure everything is okay. And so far, everything has been great.
I work with Ted for a long time now, like nearly 5 years. I am a part of 7 carers who help Ted every day. Because I know him for a long time, I try to do what he likes and the way he likes things to be done without taking his independence.
I'm lucky in that I've had only about 7 carers in the last 7 years. So they know me and I know them. There's a rhythm to my way of doing things and they know that rhythm.
The carers know their client. They know if something's wrong. They know if the client doesn't feel right. The client may not say they're unwell, but the carer will know because they're used to that client. Continuity of care, same carers with the same client.
Ted every day uses a nippy machine at night, which is very important for him so that he can breathe properly and everything. But in the morning he uses a ventilator that he uses independently.
When I was first at a hospital, my carers would leave at 10 at night. I wouldn't see them till 8 in the morning. And I'd be stuck in bed with the alert button, which I had to use on several occasions. And sometimes it took hours for somebody to come on. But now with Communicare, they're with me all night. I sleep an awful lot easier. And if there is a problem, a person comes in from the next room and I'm sorted. Technology is great, but it can fail. And my carers have never failed me.
In Communicare we have this ideal called exceptional care. Having exceptional care is building relationships from the start. We're family run. We're all part of a family. We like the clients to feel part of Communicare.
Yeah, when I come in to work with Ted, I know that I'm coming in a friend's house.
It's like the day without them just seems strange. Communicare is part of my family. They know the way I like to make my tea. They know the way I like my food cooked. And they're just there for me all the time. I've never come to a situation yet where they can't help me accomplish